Martinez from the Pulaski County Health Department here again. And it's Friday, so you know what that means. It's Fit Friday. We're talking all things fitness. So today I have the pleasure of sitting down with Dr. Jackie Chen, who is a retired podiatrist. And not only is she a podiatrist, she's a really, really wonderful runner and has been a longtime friend of mine. We also have our local HOKA rep, HOKA One rep, Ross Larimer, who's joining us from his home in St. Louis. So we're going to be talking today about some common problems that runners and people in general have with their feet and the importance of proper footwear. So Jackie, can you just tell us a little bit about yourself? Can you introduce yourself? And
Hi, yes, I'm Jackie Chen. I'm a retired podiatrist out of the Army about 6 years ago, and I've run many marathons, and any kind of foot injury that you can think of, I've had it. But I've done a lot of sports medicine and a lot of shoe training, shoe trials, you name it. I've tried everything from, I have not done minimalist, but I've done all kinds of shoe trials, and I've run on all kinds of surfaces, track, cross country, trails.
all right.
treadmill.
So we're definitely going to be talking about that today, Jackie. And it's great that you're not only a podiatrist, but that you actually know some of the, you have firsthand knowledge of the stuff we're going to be talking about. So Ross, would you introduce yourself and kind of tell them, what you do with the health department here and stuff?
Yeah, so I'm Ross. I'm a runner as well. I, have competed in track and road races and so forth, and I am a territory field experience rep for HOKA, as Melissa mentioned. So, I'm the guy for all things questions about shoes. I sold shoes at a running store before I worked for HOKA. Obviously know everything about HOKA. And yeah, we've done some meetings with this group before, and I'm excited to talk to Dr. Chen today.
Well, thank you so much. So I guess without further ado, let's get started. So Jackie, I'm going to just ask you about a few things. I kind of did just a little bit of research, some Googling. I'm definitely not as knowledgeable as you. So we're going to delve into some common running foot injuries. And let's see, some of the 7 common foot issues that wreak havoc on runners and probably every, walkers as well. One of the ones they talked about was plantar fasciitis, and I have heard so many people. Can you kind of tell us what that is?
Plantar fasciitis is the most common thing that podiatrists see. It encompasses almost 90% of our practice. And the numbers say that 90% of the people who run and exercise are going to get plantar fasciitis at one point in their life or another. So there's a difference between walking and running. Walking has both feet on the ground at the same time. Running, there's something called a double float phase where both feet are up off of the ground at 1 millisecond or however long or fast people are running. And that increases the impact of the ground reaction force when the foot strikes the ground in running versus walking where one foot is in contact with the ground at all times. So that's where running injuries are more prevalent than in people who walk. So looking at function versus fitness, shock absorption, basically the anatomy of the foot is designed to be a mobile adapter. So the foot has 26 bones and over 100 muscles and numerous tendons that allow the foot to act as a shock absorber as the foot strikes the ground, and then as a propulsive spring to propel the body forward. So the big thing is when the foot strikes the ground, that impact can be 3 times your body weight.
Wow.
So if you're a 100-pound person, there's 300 pounds striking the ground every time your foot hits the ground. So if a mile is, let's say, 1,500 strikes per foot, 1,500 times 300 pounds each foot strike leads up to a lot of stress. And running miles and miles and miles in that specific plane repetitive motion will lead to overuse injuries, stress injuries, and shoes are our protection. So the foot strikes the ground and then pronates, which is rolling in of the foot, allowing shock absorption, and then resupinates through mid-stance to propel the body forward, pushing off from the toes as a spring. So the foot has to be a mobile adapter. It has to be able to move, but not move too much. Each person is different, but there's a fine line between moving too much, moving not enough, and then there's the best ideal of moving just right and having the best amount of shock absorption you can, which is what the shoe provides. So in addition to the joint right below the ankle joint, which is called subtalar joint, pronating or rolling in at impact, there's also knee flexion, which absorbs shock also. So there's where a lot of people have knee problems, not just foot problems when running.
So a lot of things like start at the foot and can really graduate upward pretty quickly.
Correct.
Wow. Ross, I'm sure you've seen a lot of PF because I've had plantar fasciitis. Have you ever met a runner that hasn't, a long-term runner that hasn't had it at one point?
No, I think 90% of the people we know have had
And
plantar fasciitis
it's
at
just,
some point
oh,
or
it's
other.
so frustrating. It's so frustrating. And I actually switched to, I switched the Bondi and the Elevon, which is what I do with Hoka, which we're talking about that support. And I haven't had it since. Have you kind of seen that too, Ross?
Yeah, and I've been lucky to avoid plantar fasciitis for going on several years now, and I'm crossing my fingers that that'll
Yes.
continue. But yeah, Melissa, you mentioned the Bondi, I think, is one of the best Hoka shoes to help really to prevent it. And you know, like you both have said, it's a very common runner injury, and you know, it's still going to pop up from time to time. And Hoka certainly doesn't want to make any claims that, any exact claims that we're going to 100% prevent plantar fasciitis, but because of the cushion in the heel, and correct me if I'm wrong, Dr. Chen, but that plantar fascia runs from the middle of the foot where you might experience that pain if you have plantar fasciitis, and it comes up over the heel. If I'm not mistaken, the fascia comes up over the heel and into the like the Achilles and the calf area. And so that heel is an inflection point, as I understand it. So Hokas have great cushion in the heel. A lot of brands have great cushion, but Hoka is really known for it. So I think that kind of leads to Hokas being a good option if you want to kind of avoid the plantar fasciitis.
Well, the Achilles tendon fibers attach to the back of your heel, and they blend in with the plantar fascial band, which is a very thick ligament that runs from the base of your heel all the way to the base of your toes. That ligament is a thick, tense fibrous band that is not elastic. The Achilles tendon is elastic because it is a tendon and you can stretch it. So the purpose of the plantar fascial band is to maintain the arch height and the structure of your foot. And when you do repetitive pounding or prolonged standing, so you stand 6 hours a day on a concrete floor, your foot is continually being strained and stressed, and that plantar fascial band can have microscopic rips and tears in it, most commonly at the base of the heel. And that's where people have pain when they first get out of bed in the morning, take that first step in the morning. Their foot has gone from a relaxed position to a strained position, and that rips and tears the plantar fascial band again. So prevention for that is stretching the Achilles tendon religiously, also taking your toes with your hand and bending the toes backwards about 10 times, do that 3 times a day. And what that does, it also pulls the muscles deep to that plantar fascial band, that ligament, to allow for some flexibility and distributing the inflammatory cells around. Also massaging the area, wearing arch supports that can be either custom made or over-the-counter arch supports. And certain things that I tell people never to do is you don't go barefooted, don't do prolonged standing if you're barefooted or wearing house slippers or flip-flops, because there's no support. And when you look at the running shoes, they have a thicker heel we're tapering down to a thinner portion at the forefoot. So when you have a higher heel, you're taking the tension off of the Achilles tendon also. So there's not as much strain from the blending of the Achilles tendon fibers down into the plantar fascial. That is a crucial turn, that 90-degree turn from the Achilles tendon going down to the plantar fascial band. There's a lot of stress going on there. The Achilles tendon is going up, pulling up this way, and the muscles of the deep to the plantar fascial band are going 90 degrees this way toward the toes.
So those exercises that you said for plantar fasciitis, could that be something if a person or an athlete, you know, and when we say athlete here, we talk about anywhere from 13 to 103, you know, because everybody can be an athlete of any age. So would that be something that runners should, specifically people that walk or run a lot, should incorporate that into maybe while they're watching TV to do those exercises?
Yes, and daily. And also there's something called a night splint, which you wear at night, and you just put it on before you go to bed and live with that boot or splint that holds your foot at a 90-degree angle to your leg. And that gives you, if you sleep 6 hours, gives you 6 hours of constant stretch on your Achilles tendon and not letting the foot drop down or plantar flex, thereby shortening the muscles deep to that ligament. So when you wear a night splint, it's a cheater way to stretch for 6+ hours.
So would you say, what is Strasbourg sock? Would that work as well?
Yes,
Is that
the
tends to-
same idea. You want to
little bit
bring
easier?
the toes about up towards your knee, and that stretches the ligament and the muscles deep in the intrinsic muscles on the bottom of your foot and your Achilles tendon all in one shot.
So the proper footwear, if a person gets the proper footwear, could they alleviate that problem where they won't, I mean, for the most part?
Yes.
Okay.
You're trying to do the best that you can. Form, function, fitness, it all boils down to trying not to do too much too soon. And if you overdo it, then you have to back off and brace yourself,
That makes a lot of sense.
like putting a cast on a broken arm.
You know,
Running
Jackie,
mobile
I mean,
exercise.
Ross, this is very, very interesting. Jackie and I were talking about, and I had never thought about this before, because we're going to talk about next, we're going to talk about getting a compressed nerve, which is, believe it or not, last year at Racing for Daylight, that sidelined me for several weeks. I mean, just because I had my shoes tied too tight. And then I had some other problems that I told you about. And she said that, you know, you should switch out shoes, you know, quite often, which I didn't think about. I thought, well, if you get a shoe that works, you know, use it.
Yeah,
But
shoes and socks, because socks are different thicknesses.
and most people wouldn't think about that. They would say, I mean, for me, and I'm just learning this today, where you've been all my life, I know we were competing against each other, but I would never have thought about that. To me, I would think, okay, this shoe works. I'm never taking the shoe off. This type of sock works. I'm never taking this. So can you kind of elaborate on that about switching out shoes and why it was good for injury prevention?
Yes, each shoe is different, has a little bit different thickness, little bit different support, and each foot is a little bit different. So when you change shoes, you're changing just slightly, a millimeter here, a millimeter there. That's going to change the way your leg muscles are functioning. So also the surface that you're running on, if you can vary the surface instead of just running on concrete sidewalks versus asphalt, which also has a crown to the road, so then you're slanted whichever side of the road you run on, versus dirt road, versus gravel, versus a rocky mountain, versus a treadmill. So a treadmill is usually about 7% easier because it's moving for you and is a lot more cushiony. And then asphalt's a little bit exponentially harder, and then concrete sidewalks are the hardest surface that you can run on. So varying your surface, varying your shoes, changing out your socks. So thick wool socks versus a thin racing sock. They all play a difference in how your foot shoe interface functions.
That is very interesting, Ross. Did you ever heard that before? Well, you probably have, because you.
Yes, I've heard. Yeah, those are all very good points. And yeah, that's to speak back to your experience, Melissa. That's why it's important to have, if you have the means, to maybe have a couple different pairs of running shoes, and like she said, different types of shoes because they will work different muscles, but have maybe two in your rotation at the same
Mhm.
time. So you're not, and that also allows, the shoes have foam, in the cushioning underneath the foot, and that foam compresses. And, she talked earlier about how much, it's 3 times your body weight at the impact, every step you take. So that does a number on that foam underneath your foot in the shoe. So if you're running every day, some people even maybe twice a day, and you're in the same shoe, run after run after run, you're really doing a number on that shoe. So there's, if you have 2 shoes in your rotation, then that allows those shoes to kind of recover in a similar sense that you want, in a similar way you want your body to recover in between runs. So, and yeah, if you can make it 2 different types of shoes so that you can work different muscle groups, it really kind of balances it out. And so there's a lot of benefits of having a couple different shoes in your rotation at the same time, if you can afford it.
Man, that is amazing. Well, I've been switching between the Clifton, the Bondi, and the Elevon, which I love. Jackie's going to show us. Most people do the standard lace. I mean, I've got the standard lace there, and I've got the standard lace obviously here on the shoe I'm wearing. And I had worn a pair of shoes that looked good, which females do that a lot. Oh, it matches my outfit. I don't care if it hurts.
Of course.
Oh, well, that did some damage. So she's going to show us a way that that's going to alleviate that problem. Now, tell them where they generally get the compression of that nerve when they run.
Usually on the top of the foot, right about here. It's where the first metatarsal base, first cuneiform bones meet, right at basically the very top part of the arch, and where the shoelace and shoe material and tongue converge together on top of the foot. If you tie the shoelaces too tight, you will compress the nerve. It's called a superficial peroneal nerve. So it's a very common nerve. It's very close to the skin, right underneath the skin of the top of your foot, and it's easily damaged by tying your shoelaces too tight. So what I'm going to do is unlace the shoelaces all the way down, like I did on this side.
Let's see if I can kind of get that up and show up close a little bit on here, so you can
And
kind of
it's a
see
very
what she's doing there.
Yeah.
Way to also alleviate if your feet are swollen. So a lot of people with circulation problems, diabetic patients who
that's
have
wonderful.
a problem finding shoes that are too tight across the top part of their foot, the bridge of their foot. This is what you can do. So just take the shoelaces on all the way down to here, then go up the side. Do not crisscross the shoelaces over the injured area or the nerve that's pinched, and then go in front of the ankle and just, that's the next place that you crisscross, leaving this space open so there's no pressure on the sensory nerves on top of your foot. They're a sensory nerve because they're very sensitive. And it usually takes about 6 weeks for a nerve that's been injured or bruised to recover.
Yeah,
So
and you're
this is
exactly
called
right.
skip
6
lacing.
weeks. It
You
took
skip
6
the
weeks.
laces right here in the middle of the tongue, and then it allows for swelling of the feet and injured, damaged nerves.
Wow.
And
So it's a
I think
simple
that's a
way
great,
what you can do to your shoes, and not too many people are looking at how you lace your shoes. So cosmetically, it's okay.
and I think that goes back to, and you talk about your foot swelling, especially when you're running or running long distances on your feet a long time. It's really important to get the proper fit, right? A lot of people don't wear the right size with their running shoes. I like to go up a half size from what I would wear in an everyday or a dress shoe. Some people go up a full size because you want to allow your foot to swell. Certainly that trick with the laces there is a good alleviation if you've had nerve issues on the top of your foot. But I have always thought a good way to prevent that altogether is to get the right size shoe. Now, maybe you did get the right size shoe and had that problem, and then that's why you would lace it that way. But some people have running shoes that are too tight. And so, Hokas are made to be pretty roomy, as far as fit. But even if you're not getting Hoka's, make sure you're getting the right size shoe. If you have to talk to an expert at a running store or a shoe store, and I know some people might not live very close to these stores, but luckily in 2021, you might not necessarily feel good about going into the stores, but now all stores have, of course, you can always call, or some even have virtual fittings that you can do via video. That's really cool. But getting the right size shoe, I think, is really important, and that's something that gets overlooked when people first start out trying to find a running shoe.
You actually just segued very, very good into our next subject, black toenails. So we've all had some of those, right? Well, who's got toenails?
All right.
Right. But yeah, so the black toenails can be very, very painful, and that's caused by shoes that are too small, right?
Yes, or running downhill and your foot slides forward into the tip of the shoe, going and repetitively hitting the tip and the top of the shoe. And that allows for bleeding and bruising underneath. Mainly the big toenail is the one that gets abused the most. And then that blood separates the nail plate from the nail bed. And over time, after the blood dries, then the nail is no longer attached and it'll just fall off. But that's not too big of a deal if you
They can be painful though.
It can be.
They can be very painful.
Very painful because of all the swelling and fluid buildup, just like a blood blister underneath the toenail.
So going up, would you recommend, like Ross said, I know I as a running coach, I've always said, as a standard, say you wear a size 8, and I want you in an 8.5, or like Ross said, even in a 9, depending on the shoe, right?
Yeah, and depending on the person, right? So I think, that's a great point about black toenails. So it's, obviously we use the word fit to describe, right? You want the right fitting shoe, but it's, you want just the right amount of room. I like to look for like a thumbnail length of space between the tip of my toe and the edge of the shoe. So I'll check my big toe, or really it's good for someone to check for you, because when you bend down to check.
Yeah, because you have to do it standing.
Yeah,
Right.
The person has to be weight bearing inside, with their foot inside the shoe, and then another person will put their thumb right about here and see where their big toe comes up at through the cloth of the top part.
And they need a full thumb, right? A full thumb?
Yeah, I think that's a good, pardon the pun, a good rule of thumb. Is to have about a thumbnail length between the tip of your toe and the edge of the shoe. Because like we've talked about, fit is important and it's different for everyone, but that's generally what you're looking for.
I love that. Boy, we are getting some very, very good information today. What about stress fractures, guys? What causes those? What can we do to prevent them?
Well, bones in your whole body are alive. The bone cells turn over all the time. And when you have too much stress going through the foot, it was originally found in soldiers doing foot marches. They're called march fractures. Stress fractures are same thing as a march fracture. And usually in soldiers wearing their boots, they'll get it in the metatarsals, which if you look at your hand, these bones are the metatarsal or the metacarpals, but in the foot, they take a lot of stress. And what originally occurs is there's microscopic breaks in the cortex of the bone. And with repeated stress, then the metatarsal or whichever bone, you can get a stress fracture anywhere in your body. You can even get them up in your head.
Wow.
But any bone can have a stress fracture, which means there's a break in the cortex of the bone. And then the body tries to heal that by sending more blood down to that area and sending more bone cells to that area to heal that fracture. So when you see somebody with a stress fracture, initially you'll see a red swollen area with pinpoint tenderness on top of the foot. It's usually not tender on the bottom of the foot because there's so many layers of muscle. But right on top of the foot, there'll be a red area with swelling and pinpoint tenderness on the metatarsal, usually around the metatarsal neck area. And then stress fractures usually take about 6 to 8 weeks to heal with proper immobilization and
Yeah.
rest. And then you'll feel a lump because there's new bone cells laying down around the weakened part that's broken to try to glue that area back together. So you'll feel a big lump at the stress fracture site.
Wow. Will it stay
And
there?
then, no, because the
Okay.
bones are remodeling and over a period of about 3 months, then that lump will shrink back down. And when you take an x-ray, say 6 months later, you'll never even see that there was a break in the bone because the bones are alive. The cells will remodel and get you back almost 100% brand new, maybe even stronger than before.
That is amazing.
So,
Wow.
but certain bones don't heal as well or as easily as the metatarsals. So the heel bone, which called the calcaneus, is like an egg. It's got a thin cortical shell, but the inside is soft and spongy to help absorb the shock every step you take. Again, you're landing on your heel and you've got to support your body weight plus. So if you get a stress fracture in the heel bone or the calcaneus, that takes a little bit longer to heal.
Wow. So what are the other 3 top foot problems that you see or that you have seen? Would it be blisters, bunions, hammer toes?
Well, there's quite a variety, but in terms of sports medicine for runners, the more common things we see are tendonitis, Achilles tendonitis,
Had that.
shin splints, and number one, plantar fasciitis, of course. That's the most common thing we
Yeah.
see. But you have to differentiate plantar fasciitis or heel pain from other more serious conditions like a stress fracture, a bone tumor, nerve damage. Some of the arthritis, such as rheumatoid arthritis, will present with heel pain. But that's not our topic today. Our
Yeah,
topic is
there's a
more
lot to
sports
it though.
medicine.
Yeah,
But
there's a
you
lot.
can't just simply say, oh, my heel hurts, oh, it's just plantar fasciitis.
Yeah.
It could be other more serious complications.
Yeah, that's
Diagnosis. So you can't just blanket statement, plantar fasciitis. You know, nerve damage, tarsal tunnel syndrome, which is a pinching of the nerve inside the inner ankle when people roll their feet in. It's similar to carpal tunnel syndrome. People are familiar with carpal tunnel syndrome in the wrist,
Mhm.
but there's tarsal tunnel syndrome in the foot and ankle that can lead to burning, numbness, pain, inability to walk. So
well,
nerves are very, very
Ross,
easily injured.
now that she said that, because, and I love that because it all goes back to prevention, to making
Yes.
sure that you're in the right shoe. Because I know from personal experience as well that the wrong shoe can make or break, whether you're a walker, runner, a nurse, someone who stands on their feet all the time. So Ross, give us some of the tips. If you guys can kind of go back and forth on the best things on how to ensure that you have the right fit for a shoe and the right model.
Yeah, and there's a lot of shoe models out there. There's a lot of shoe brands, and even like within a brand like Hoka, I mean, we have dozens of models now. Some are made for trail based on the tread that they have on the bottom. A little bit more aggressive tread would be better for rocky trails or even gravel or muddy areas. And then some of our best-selling shoes are made for either road, whether it's concrete or asphalt, or indoor use, like you said, someone that's on their feet all day, maybe a nurse or a factory worker. So, I think at least within Hoka, if you're looking at shoes, you want to determine first, what kind of tread do I need on the bottom? What kind of surfaces am I going to be using this shoe on for the most part? And then there's varying levels of cushion, and like I said, Hoka's kind of known for cushion. Like, for example, the Bondi is the top level cushion in our best-selling shoe. And then there's a couple categories that are commonly known as neutral and stability for running shoes. So neutral is, with regards to neutral versus stability is with regards to whether or not you overpronate. Like Dr. Chen mentioned earlier, everyone pronates a little bit and then you resupinate as your foot lands and then you push off and go on to your next stride. But some people overpronate quite a bit where they're really rolling in to the inside of their foot. And so Hoka has a couple models for those. Those are called the Gaviota and the Arahi. And actually, I have a Gaviota here. I don't know if it'll show on my screen. This is the all-new Gaviota 3, which released a couple days ago, February 1. And so for the stability shoes for Hoka, for those people that overpronate, I don't know if you'll be able to see this. I wish I had a different color, but we have what's called the J-frame. So on the inside here, sorry, I'm holding my phone and the shoe at the same time, so I can't point. But on the medial side, on the inside of your foot, where an overpronator would roll in, there's a little gray area, and that's just letting you know it's a denser material. If you have a different color shoe, it might not be gray; it would be a different color. But it's a denser material to help protect that, and we call it the J-frame because it's in the shape of a J, and it goes all the way around your heel as well. So I don't know if that's going to show on the screen here, but the two Hoka shoes with the J-frame to help protect for overpronating, if you really roll in on that arch or that medial side, are the Gaviota, which has the most protection, and then the Arahi, which has kind of a medium level of stability. So, you know, again, you want to think about what terrain am I going to use this on, and that determines whether you want a trail shoe or a road shoe. And then, you know, most people looking at a road shoe determine, do I need a neutral shoe, which most people would fall into that category, or do I overpronate? And again, that could be tough to determine on your own. That's where maybe going into a store that has shoe experts would help you determine that. And there's all kinds of technology these days to figure that out. But if you are someone that overpronates, then you want to look for a stability type shoe that has some sort of I'm going to call it protection, or, you know, stability is the word that's used on that inside. So when you land and you overpronate, you're protecting that arch.
Wow, you want to expand on that a little bit?
Okay, well, basically the people generalize that there's three types of feet. There's flat feet, there's the normal arch foot, and then there's the high arch foot. And shoes also have gone in that trend as being for flat feet is more a stability shoe to give you more bracing, and a neutral shoe is more for a moderate arch height. And the highly cushioned shoe is usually for the high arch feet, which need just simply cushion, but no stability because they're not pronating as much. And then I just wanted to talk a little bit about in the past about minimalist shoes versus maximalist shoes. So that book, Born to Run, really pushed the minimalist shoes or barefoot running or running in flip-flops or sandals, and that kind of fell out of fashion because so many people got injured from trying the minimalist shoe. Because we're brought up in a society where we've got sidewalks and we've always worn shoes. Almost everybody walks around with shoes on. Very few people are going around barefooted in our society. And with a typical running shoe that we grow up with, the heel is thicker than the forefoot, because there's also now there were shoes that are promoting zero drop shoes, which means that there is not a thicker density material underneath the heel, but it's the same from the forefoot to the rear foot. And that is similar also to the minimalist shoe theory, where your foot function needs to get stronger by being kind of like a barefooted person, where you allow the intrinsic muscles to work harder and make your foot stronger theoretically. But in our society today, I think that we have to have shoes because that's the way we grow up, and that's what society expects of us, to have proper shoes that look like a typical shoe.
Right.
So a thicker, denser heel tapering down to the forefoot. And biomechanically, it's a little bit good to have a higher heel because that keeps your foot in a less pronated position. When your foot's completely flat, you're going to tend to pronate much more. And when a foot is pronated, that means it's what we learned in biomechanics is it's being unlocked. So it's floppy. So motion, too much motion leads to injuries and overuse. When you have less floppy, more supported, rigid foot for propulsion, you're going to be a faster runner. You're going to be looked at as a better athlete.
Ooh, that's awesome.
So somebody who is more up on their toes, like a sprinter, their heel doesn't touch the ground when they're running, but they're up on their toes, which is in a more supinated, not a pronated position of the foot, and they have much more spring power. There's much more energy transfer from the ground pushing their foot up when their foot is up on their toes, pushing forward all the way through. So
Sounds like she's talking about the Carbon X.
that's kind of
Well-
what in general people look at in 3 foot types, 3 different types of running shoes. And
So
it's
that's
a big generalization. I mean, each person is different. There's
Right.
you can't overgeneralize, but in a short amount of time, it's
Right.
basically we're just going over the basics. And
Mhm.
what I always tell people is try on 3 to 4 different pairs of running shoes. What feels the best on your foot is probably what is going to work for you.
That's awesome. That's
So
good.
if you
little
buy
thing again.
a $300 shoe and it looks good, but it doesn't fit your foot and it doesn't
Mhm.
feel good on your foot, that's not the shoe for you.
Yeah.
So I tell people go for fit first, because the width of the foot is different compared to the shoes. Not everybody wears a C width. Some people are D width or E width or B width. And
So basically
it's fit,
it's-
and where the arch hits your arch is also going to make a difference in how the shoe feels on your foot. Also, the rear foot control, the heel counter around your heel. Is it snug? Is it loose? Does it dig in? Some people don't like the Achilles protector digging into the back of their heel. Again, I tell people you have to try on many pairs of shoes so you know what feels good on your foot.
Okay, I love that.
Yeah, a lot of really great points there.
Mhm.
You know, a great summary of, you know, kind of the advantages and disadvantages of a minimalist shoe and what we've learned over the last few years after that minimalist craze. You know, a great point about, you know, everyone has a different width foot. A lot of shoes end up being, you know, B width for women, D width for men, and then there's usually wides available too. But, you know, different brands run differently. So yeah, that's why trying on a number of different shoes. I'll even say, even as a Hoka rep, try on a few different brands, you know,
Mhm. Yeah.
just make sure one of them's a Hoka, and exactly the one that feels the best is probably the right answer. Your body is telling you, you know, usually which one would work best long term. Yeah, so a lot of really great points there about things to think about when you're looking
Yeah.
for the right shoe.
Well, guys, I love that. I think for the sake of time, I think we've talked about as much as probably anyone can stand as far as
Okay.
feet, right?
Yeah.
But no, it's been very interesting. And I've been a long time runner and I've learned a lot today. So I really, really appreciate that. I love this lace thing. And Ross, I would love to have you back on. Maybe we can go live and we can have people ask questions.
Yeah.
I know just this week I had some ultra friends talking about, you know, trying a different shoe. And so that happens a lot. So we'll definitely plan on that. And Jackie, we'd love to have you back again because we've just hit the surface. I mean, we haven't even talked about socks and inserts and bunions. We haven't talked about athlete's foot. We haven't talked about, I mean, there's a lot of stuff we could cover. So if we could get you back on again, we would love to have you. Ross, thank you so much. It's always a joy to have you.
Thanks for having me. This was very informative and lots of fun. Thanks.
All right, guys. Happy Friday.
Happy Friday.
Friday.